It's the news every parent dreads. There is something wrong with your baby. For Colorado couple Manuel and Tiffany Esquivel, who struggled for years to have a baby, the news is especially hard to take. Their son Sam was born with one of the most extraordinary and unusual conditions we have ever seen. We're going to meet the miraculous little boy and talk about the happy ending in just a moment. But first, his story.
We were ecstatic, considering we didn't think we could have any babies.
We tried for several years, and we finally came to the conclusion that we couldn't get pregnant, and we stopped trying.
But just when Tiffany and Manny had given up, the Esquibels say a miracle happened.
I had a very normal pregnancy, enjoyed every minute of it, and it seemed to be just fine.
But by the end of Tiffany's pregnancy, an ultrasound showed something unusual.
What they called it was fluid in the ventricles of the brain.
Tiffany would have to be induced.
Prior to walking into the hospital, I said, okay, when we come back out, we're going to have a baby in our arms. And we didn't. He was in another hospital.
Doctors detected a mass in Sam's brain.
They actually told us that, it was a 50-50 chance whether, he could make it through it or not.
Just 3 days old, Sam was now in the hands of pediatric neurosurgeon Dr. Paul Grab.
Some of these tumors can be quite dangerous, so you try to always prepare a family for those types of difficulties.
Even Dr. Grab was not prepared for what he'd find on the operating table.
A lot of us that have been in practice long enough like to think we've seen everything. Well, that just goes to show that you haven't.
Inside the large tumor on the right side of Sam's head was a perfectly formed foot.
We began removing the internal parts of the tumor, and it was pretty soon after that that the foot quite literally popped out of the tumor. It made me stop operating since I'm not used to seeing feet in the brain.
Doctors believe the tumor is a teratoma, a rare type of complex tumor that can actually form appendages.
This would be one in a lifetime finding in the operating room.
Today, Sam is 3 months old, back home and recovering, but healthy.
He's doing great. He's doing really good.
And we're happy to have Manuel and Tiffany Esquivel along with their son, Sam. And NBC's chief medical editor, Dr. Nancy Snyderman, joins us as well. Good morning to all of you.
Good morning.
Let's just start with the most important thing. How's Sam doing?
Oh,
he's
doing
adorable.
Great.
Yeah, no lasting effects from the surgery at all?
Not that we know of so far. He has a small gaze with his eyes.
Right.
But they think that he'll just outgrow that and work with it.
I was reading, Tiffany, that when late in your term, you went past the due date and they wanted to induce you and you said no. And in some ways that decision may have saved Sam's life.
Absolutely.
Why?
If they would have induced me, they would have sent me home with thinking I had a healthy baby. And we would have found out later that he had problems.
Because they did the ultrasound, that late-term ultrasound, they saw the mass in Sam's brain.
Yes.
So you have Sam, and then the doctors come into you after examining Sam, and I think they asked you the question, are you religious people?
Yes.
How do you handle that question, and what did you think they meant by it?
That was the toughest part that I went through, was when they started saying, you might want to get your son baptized. That was very hard to take.
Yeah, it was really hard.
When they start to go into what is now growing in Sam's brain, how did they break this news to you that not only was there a tumor, but what the tumor contained?
They just looked at us and said, it's just remarkable. It's for the books, what we found. And we were just stunned. We didn't know what to think when they told us what they had found.
We've been saying all morning long there was a foot inside this tumor. There were actually other things growing in the tumor as well. For example, what?
I think there was another partial foot forming, a thigh, kind of a thigh part of the buttocks was growing also.
And then a hand.
And Nancy, let me bring you in here because I understand there's basically two possibilities of what this could have been. Can you
One is called a fetus in situ, which really means that it's a fetus developing in an abnormal part of the body. I have never seen one in the brain. I'm not sure there's ever been one recorded, because that sort of assumes that there's going to be a normal fetus. The other thing is called a teratoma, and that's, I believe, what Sam has. And it's a tumor that's formed from different layers of a normal fetus. We all start with 2 cells, and then everything's supposed to migrate into the place where it ends up. Your feet on the bottom of your body, your ear on your head. sometimes the message gets sort of screwed up and things don't quite migrate. And I looked at Sam's pathology report, and in fact the doctor says little skin, cartilage, and surprisingly a foot. Pathologists don't usually get that jocular on a pathology report. They were all surprised.
I was going to say, and from what I read from the doctor's comments, Dr. Grab, if you had shown this, if any neurosurgeon had come across this, they would have stopped right in their tracks.
Absolutely.
That's how rare this is.
It's unbelievable. I've seen quite a few teratomas in my life when I was a younger pediatrician, but in the neck, in the chest, in the abdomen, never seen one in the brain.
And here's the good news here, and I would hope they talked about this with you immediately, is that these tumors are rarely cancerous.
Yeah.
Yes.
So here you've got this shock to your system, but your son has a tumor. The good news is probably not cancerous, and that proved to be true, correct?
Correct.
So far. He still gets tested once a month to make sure that the tumor isn't growing back and that it isn't cancerous.
They're going to follow up with MRIs, Matt, because developmentally they're going to want to make sure that Sam's okay. And brain sort of gets squished aside when there's anything that's occupying space where it shouldn't be. But the fact that he's developing normally, the fact that he's going to get followed up with MRIs and blood tests, it all bodes really well.
So you struggled for so long to have a baby, and you ended up with a miracle baby.
He is a miracle. We just love him so much.
Definitely flipped our life around, that's for sure, for the good.
You should, and we wish him continued good health, and keep us posted, all right?
All right.
And congratulations to both
you.
you. Sam, you made it. You hung in there, pal. Way to go.
And right now there are doctors ready to write up this case report. This will be the first study for some good young physician who's seen a true miracle.
And they got a website that you've done for Sam, and so for people who want more information, we'll put the link to that on our website as well.
Great. Thank you.
Tiffany and Manuel, thanks very much. Sam, thank you. Nancy, thank you. We're going to be right back after these messages.